Okay, here is your stem.
Yes, ma'am. I'm ready, ma'am.
Just 16 seconds. Okay, so if you've read and understood, considering it critical care scenario, please tell me how would you manage this patient now?
This patient is having obstructive jaundice, so I will
Okay.
start the patient. I will resuscitate the patient first. I will put the patient on IV fluids and antibiotics, and I will investigate the lab values, and then I will do an ultrasound abdomen to see if there is any evidence of obstruction in the common bile duct.
All right. Considering the situation of the patient, how you concluded or how you came to this provisional diagnosis that it could be obstructive jaundice?
Yes, ma'am, because urobilinogen is not detected in the urine.
Okay.
Keeping this in mind, I will confirm my diagnosis. It could be obstructive jaundice, ma'am.
What should be the normal level of bilirubin?
It should be normal. It should be 3 to 30 millimoles, ma'am.
Okay. Uh, Direct or indirect? How much should it be the direct, the conjugated bilirubin?
I'm sorry, ma'am. I'll get back to it
Okay.
later, ma'am.
What type of bilirubin is found in the blood?
Conjugated bilirubin, ma'am.
Okay. Why urobilinogen is not detected in the urine in this particular patient?
Ma'am, because when there is obstruction, the bile does not enters into the small bowel.
Yes.
So once it enters into the small bowel, it will in the terminal ileum, it will go for intrahepatic circulation. So that is, it is reabsorbed, and a small portion, probably 10% of bile enters into the colon. So where this conjugated bilirubin gets disintegrated and it becomes urobilinogen, and this gets oxidized to form stercobilirubin. So this urobilinogen is enters into the hepatic circulation, and it results in formation of yellow color in the urine. So once it doesn't enters into the bowel, so urobilinogen cannot be traced, ma'am.
Okay. Can you please tell me why the clotting
Factors, yes, ma'am.
factors are deranged in this particular patient?
Yes, ma'am. Because liver produces majority of the clotting factors. So once the liver is damaged and the bile duct is obstructed, it is not it doesn't produces clotting factor, and there will be reduced absorption or nil absorption of vitamin K. So which is also responsible for production of clotting vitamin K dependent clotting factors, that is 2, 7, 9, and 10.
How should this clotting abnormality can be corrected?
We can correct by giving IV intravenously vitamin K, prothrombin complex concentrate, and by giving fresh frozen plasma.
Okay, good. Can you please tell me how would you explain or describe intrahepatic circulation?
Yes, ma'am. So once, as discussed earlier, the bile enters from the bile duct to the small bowel through ampulla. So this bile and into the terminal ileum, where 95% of bile salts is reabsorbed and it is directed towards the liver. So this is enterohepatic circulation, ma'am.
All right. Can you tell me what are the different types of jaundice that you are aware of?
Yes, ma'am. It could be have a prehepatic, hepatic, and post-hepatic jaundice, ma'am.
Kindly
So
give yes
uh,
examples.
prehepatic is mostly hemolytic jaundice. hemolytic jaundice, which is examples are G6PD deficiency, hereditary spherocytosis, and sickle cell anemia. Or the other one is Gilbert syndrome. Hepatic jaundice, it is mainly due to alcoholic or viral hepatitis, drug-induced hepatitis, primary biliary cirrhosis, hepatocellular carcinoma, and alcoholic liver disease. And post-hepatic could be because of obstruction in the bile duct, which could be because of common bile duct stones, parasite obstructing the common bile duct, and cholangiocarcinoma,
Good.
sclerosing cholangitis, and head of pancreas, carcinoma of head of pancreas.
Can you tell me if you suspect on ultrasound that there'll be a biliary obstruction, what findings would you find by doing ultrasound?
Ma'am, there will be dilatation of the extra and intrahepatic bile ducts, ma'am.
And if ultrasound confirms there is stone and dilated biliary radicals, then what would be your next step?
I would post the patient for ERCP.
Okay. Before doing that,
I will correct the clotting factors, ma'am. I will start vitamin K and prothrombin complex and fresh frozen plasma. After that, I will post the patient for ERCP, ma'am.
All right. Can you please tell me what are bile salts and what are the different types of bile salts you know about?
Bile salts is a constitute of the bile, ma'am. So it is a bile salt contains sodium glycocholate and sodium taurocholate, ma'am.
Chlorine and glycine. Okay. Different types of bile salts that you know, primary and secondary. What are their
Bile stones, ma'am.
differences? Yes, bile
Yes, ma'am.
salts. Bile salts.
Bile stones, ma'am.
Sorry, I'm asking for bile salts.
I'm sorry, ma'am. I'll get back to it later. Ma'am.
Okay. You were telling me about different types of bile stones.
Yes, ma'am.
What are the most common bile stones that one can come across?
Pigmented stones, ma'am.
No.
Mixed.
Yeah, mixed.
Mixed
All right.
stones.
Okay. Can you please tell me if you suspect that patient has cholangitis? Would you or would you not recommend antibiotic for that patient?
Ma'am, I will definitely recommend antibiotics for that patient, ma'am.
Yes. Which one and why?
Probably I will put the patient on higher antibiotics, ma'am. Meropenem.
According to your trust guidelines.
Yes, ma'am.
All right. Okay. What is ERCP that you said you will go for?
ERCP is endoscopic retrograde cholangiopancreatography, ma'am.
Okay. What type of intervention is that?
It is both therapeutic and diagnostic intervention, ma'am. We can have both therapeutic and diagnostic.
Okay, good. Can you please tell me where exactly bilirubin is conjugated? In the liver.
In the liver, yes, ma'am.
Yes, you already knew it, but I'm still asking. Right. Bilirubin, can you tell me the process of processing of bilirubin in the gut?
Yes, the bilirubin enters into the small bowel.
Yes.
And then it goes for enterohepatic circulation. That is 95% of the bile salts, bile pigment are reabsorbed and they go through to the liver. And 10% passes through the large bowel into the colon. So in the colon, the conjugated bilirubin gets disintegrated by the bacteria present in the colon. So they disintegrate into urobilinogen. So this urobilinogen undergoes oxidization and it forms stercobilirubin.
Good. And yeah. And the remaining 10% is urobilinogen, which is reabsorbed in
it enters into enterohepatic circulation.
Good. Okay. Thank
Yes,
you.
ma'am. Thank you, ma'am.
Thank you.